All right, so we're going to talk about doing a newborn skin assessment. Basically, very similar to an adult, you're going to go kind of head to toe, look all over, check the skin out, see how the baby's doing. Babies, when they're first born, have something called vernix, which covers their skin. It's like a cheesy white skin covering. This is normal, and it can be washed off after birth if when the mom decides. So this is something that you might notice right away, but if they've had a bath, then you might not notice it. So we're going to start at the head. So you're kind of going to look around to see if there's anything you notice on the skin. If the baby was born with forceps or a vacuum-assisted birth, the vacuum-assisted birth, you might see kind of a spot on the top of the head where the vacuum was. It might be a little raised. You might notice that. If you look on the side of their heads, if there was forceps, you might see an indent or some bruising from that. We're going to look at the face. So baby acne is something that you might see in newborns and, neonates, and it kind of looks like adult acne. So you'll see that here. Also on the face, you might see a stork bite, which is kind of like a little reddened patch, and that can be on the eyes, the forehead, the nape of the neck. Kind of see it in this general area here. Usually this fades on its own. Going down to look at the rest of the baby, so babies have some fine hair called lanugo that you might notice, and that can be a lot of the time on the shoulders or the back, but actually sometimes you find it kind of all over, and it can be very, minimal, or you can see a whole lot of it. It just depends on the baby. Looking down, sometimes you also will see some acrocyanosis, which is some bluish tinting to the hands or the feet, and that can mean that something's happening, or for some babies, especially in the initial beginning of life, that is normal and doesn't mean that there's another disease process occurring. Continuing down, so a lot of babies have like birthmarks, and that's something that you might notice kind of throughout their body, especially on the trunk area or their legs. Mongolian spots tend to be in the lumbar part of the body. They're blue grayish patches that you might notice. Cafe au lait spots are also sometimes noticed. They're tan to brown, and they're usually more on the trunk area. Baby skin can also be different colors, so they can have some pallor, so be very pale. That can sometimes signify anemia. Also, jaundice is something that is very commonly seen in newborns. Onset is after the first day of life. For some babies, it resolves on its own. It's very normal. For others, if their bilirubin is very high, they may need some treatment for this. Mottling is another thing you might see, and that's kind of like a patchy, irregular color throughout their skin, and sometimes this can get worse when babies are agitated. So, just some quick stuff on newborn skin assessment. Thanks!